Periscope. Thank you for your patience on the Periscope, for the Anchor podcast and everything else podcast-wise. Thank you for joining us on our Beanbag Banter. So thank you for viewing our program here. And our topic for today is going to be about Medicare Part B home visits. And this is particularly targeted to assisted living facilities, residents, and their loved ones. And for today, we are very, very much thankful to have Marwin Pasqua. He's going to be soon a doctor of physical therapy. And we're so happy and proud to go ahead and have this this dude, to go ahead and join our team. We're so excited to go ahead and have him. And he will be the one, for the most part, doing these home visits for Medicare Part B for assisted living facilities. Welcome.
Thank you for having me here. That's quite an introduction.
All right, of course. I'm going to get my dollar later on for that intro. But no, he definitely deserves all of that. So we're super lucky to have him as part of our team. So let's get to it. First, let's go and clarify first. Who need, for the residents who are in assisted living facility, let's go ahead and clarify first in terms of Medicare Part A and Part B. So Part A, you are homebound, is that correct?
Yes, that is correct.
Okay. And for Medicare Part B, you are no longer homebound, and you should be able to get out of the house.
Mm-hmm.
Yes. Okay. Now, and given that, what is so special with AAA Physical Therapy in terms of using Medicare Part B for these assisted living facilities? What is it that you would be able to do for them?
Well, I think we should start off with what we can do for the patients.
Mm-hmm.
It's a misconception that therapy is just for the sick and for the severely debilitated.
Mm-hmm.
Because the overall goal of therapy is the wellness of all the patients, or of all the individuals.
Okay.
But so do you want to start with talking about the Medicare?
The Medicare section of it?
The Medicare section of
Yeah,
it?
so before we go bounce off of that, definitely, that's where physical therapy will go ahead and come in. You don't have to be extremely in pain or to the point that you cannot move, none whatsoever, to go ahead and reach out for physical therapy services. So definitely,
That's right.
So thank you for going back to that core of why we are here. Now, moving forward to Medicare Part A and Medicare Part B. So we talked about being homebound versus going to outpatient. But for us, for AAA Physical Therapy, you going to them for home visits,
Mm-hmm.
for Medicare Part B, that's the service that we are able to provide.
Right. So for those individuals who are not able to come in here in the physical therapy office, we can provide the services through Medicare B by going to these the ALFs
Okay.
that we are associated with.
Yes. And with that, because for the most part, these residents are fully aware that the physical therapists come in. And that's where Medicare Part A is being used. But what they don't know is that we can also provide services after they are done with Medicare Part A to continue the physical therapy services using Medicare Part B. And that's where Dr. Marwin to be, all right, I'm already projecting into the world that that's going to happen in the next 2 months here, next 3 months, is that he's going to come to your home as well, to your ALF as well, to continue and provide Part B services. So what is homebound and what's outpatient, and why would it be great for you to go ahead and visit them for Part B services?
I just want to say that it's also a misconception that after your Medicare A runs out, that you're not eligible to receive continued physical therapy services. Medicare B will allow us to do those visits too. I'm sorry, what was your question again?
Yeah, so in terms of why would it be beneficial for them to continue with Medicare Part B?
Right.
So after they're done with the Part A.
Right. Well, there are still a few things that. There are many ways that we can intervene with the patients who are already in the ALFs that are already done with their Medicare A. For example, I would say the most common would be patients who are a fall risk.
Okay.
All right, should we go into that?
Sure.
All
Yes.
right.
I mean, we did a video with Olive, all right? Hopefully you guys have already seen that regarding fall risk. Go ahead.
Right, yeah. Well, the physical therapist can intervene, or yeah, before the intervention, we can also do the screens to determine which patients are fall risk.
Okay.
All right, and our intervention for them would include balance training,
Mm-hmm.
strengthening, modification of the environment, and also educating the staffs and the family, because we can also utilize them in training these patients, and
Mhm.
also educating them with the appropriate level of assistance that they need to give to the patient, because you don't want to over assist these patients. You
Yes.
also have to give room for growth or room for improvement.
Okay.
Mm-hmm.
And that's where you go ahead and continue to start goals. So the goals
Right.
that you have for Medicare Part A is different from the
It's
goals
very different.
from Medicare Part B.
Mhm.
And what are can you provide at least one specific example? So we already identified in terms of fall prevention, all right? But can you identify one goal for Medicare Part A versus Medicare Part B? Would you be able to provide one specific example for that?
Well, it will be less specific,
Okay.
but
Or to differentiate
yeah.
one from the other a little bit more, because again, what's homebound, what's not homebound?
Well, homebound means that a patient's not able to get out of where he is and get to the physical therapy clinic to get the services.
To get the services. Okay. And that's the reason why we're doing this for assisted living facilities, because we know they're already challenged to be able to go out.
Right.
But we don't want their abilities and skills and movement and strength to diminish. And again, that's where you'll go ahead and come in.
That is true.
Okay. All right, great. So now you talked about fall prevention, because to those viewers right out there, or to those listening to the podcast, just think about this. If you fall, what are some of the things that could happen if somebody falls?
Well, a broken hip, that's very common for an elderly who is very fragile
Mhm.
and who's going to sustain a fall.
Okay.
That can be very costly. You know,
A broken hip. Anything with the word broken, it's not good.
Mhm.
And if that's something that we can help prevent, why not?
Mhm. Right. That's true.
Okay. All right. So definitely that's one of the major things. Okay. So the other challenge that we are hearing with assisted living facilities is because with Medicare Part B, there would be secondary insurance that should cover the remainder of what Medicare Part B does not cover. And if they don't have if they don't have that secondary insurance, they will pay out of pocket. And this is where we want to clarify things a little bit further. Normally, let's say it's going to be $20 per visit, let's say for about 10 to 12 visits,
Uh-huh.
to go ahead and make sure that you have a
Yeah.
balance that is established, and then in terms of risk of falling is going to be diminished.
Mhm.
Yes? And so if you overall you go ahead and pay out $200, and you mentioned earlier a broken hip is a common problem or a common occurrence because somebody falls. How much is a
To be honest, I have no idea, but I just know it's very
It's
expensive.
very expensive, yes.
If you're just gonna pay out of pocket, that would still be justifiable if that's gonna help prevent a broken hip.
A broken hip, yes. So and think about this. Anything broken with your bones, it's not going to be fun. The logistics of taking care of going to the doctor and so on and so forth. And guess what? After you do surgery, you'll be back to physical therapy anyway.
That is true.
And that is why prevention is the key. And again, if you watch the podcast, the Beanbag Banter with Olive, the other awesome physical therapists that we have here, that's what we talked about, that an ounce of prevention is better than a pound of cure.
That's very true.
And here we are to these assisted living facilities. And here's the other advantage for ALFs is that obviously they don't want to have records of people always going to the hospital, right?
That is true.
And that is why we all need to work together with the administrators, to the staff members, and that's what you said. You work with the staff members to provide training, all right, to go ahead and make sure that the lesser the accident, the better. Okay? And of course, for you and your loved ones, you don't want to be overburdened of going through a whole bunch of other medical doctor visits, going through surgery, and going through physical therapy again.
And also, what other people don't understand is some people don't treat a broken hip very seriously, but
Mhm.
there are studies that say that it's for the elderlies, it's very it's it you know the mortality rate.
The mortality,
I don't
okay.
wanna.
Yeah, I mean, we don't want to be morbid here or whatever,
Well, I
but
can provide-
unfortunately, that's going to be part of it.
Right. Yeah, I can provide the literature about it at the end of this video.
Okay, sounds good. All right, great. And all right, now I always hear this acronym ADL. What is ADL? Yeah, what is that?
ADLs.
Yes.
ADLs would be activities of daily living. They're
Okay.
and it's yeah, it's simply for example, bathing, eating, or transferring from one surface to the other, or locomotion or walking.
Okay.
Yeah, ADLs. It's a very vague term, but it's simply the daily activities that you do.
That we do.
Yep.
And that's where you come in, and we'll be able to help them out.
Yeah. Because all right, for ALFs, for the ALF setting,
Mm-hmm.
yeah, that's also one way we can intervene. Because we must understand that these patients, before they were put here in the ALF, they used to be independent in their functioning.
Yes.
You know, and some patients find it hard to transitioning from that independent living conditions to an ALF setting or
Yes.
assisted living conditions,
Mhm.
right?
Yes.
And physical therapists can help with that transition. For example, incorporating things that a patient used to enjoy to do. Like, for example, if a patient used to play or enjoy tennis when during his or her younger days,
Mm-hmm.
the patient might also enjoy doing balloon tennis. By doing that, you're modifying the activity into something that the patient would enjoy. Therefore, you're preventing the decline in function,
Mm-hmm.
and that's that improves the quality of life.
And that's a key phrase there. Improves or maintain the quality of life that we want to go ahead and establish. So yes, that is indeed an important key, and that's why it is really beneficial that Medicare Part B is used to your advantage. It's there. That's something that you guys work for, and sure, a 20% co-insurance could be a burden for you. But if you look at all of the other advantages of continuously working with a medical health professional, why not to go ahead and do that? So, again, hopefully that's something that you guys can go ahead and consider in terms of your stay at an ALF and have Dr. Marwin to be able to go ahead and help you with your program, with the quality of life, with your range of motion, with your strength, with your balance, and so on and so forth. So if you have further questions, go ahead and check our website. That's AAAphysicaltherapy.com, or call us here at 443-979-7171. And work with Dr. Marvin to be here, and then find out how we can definitely help you and continue. And then we know you're in an ALF, but it does not necessarily mean you're going to decline in terms of your health and wellness here.
Yeah,
Alright.
there are another example would be the Alzheimer's and dementia, for example.
Okay.
Those are progressive diseases.
Okay, yeah, with
Right.
progressive diseases, yes.
Right? We can also intervene with that. Not to be too focused on the disease, but the overall wellness of the patient.
Mm-hmm.
There's nothing's gonna stop the progression of these diseases,
Mm-hmm.
but we can minimize its effects. Right. For example, we can work with the behavior modifications. There are a lot of techniques for that, and we can also work on what's left of the patient's motor function, or to put it in better terms, maximize their current physical capabilities.
And don't just decline
Exactly.
free fall.
Exactly, and that will at least stunt the progression of these progressive diseases.
Progressive disease.
Mhm.
Because it's progressing in that direction.
Mhm.
Stop the progression of that disease. And that's where Medicare Part B will go ahead and come in and help out with such things. So yeah, thank you for bringing that up, because see, indeed there are ALFs out there that is uh, your expertise that to work with such situations. So yeah, all right, great. Thank you for bringing that up. So again, if you guys have questions out there to the listeners and to the viewers, just go ahead and contact us and go ahead and find ways to go ahead and reach out to us and find ways on how just maintain and avoid any other unnecessary regression.
And actually pain too.
So-
I'm sorry.
Yeah, go ahead. No, that's
pain,
great.
Pain
Yeah.
too, you know.
Oh yeah, definitely
Right?
pain. Yes, of course.
Because,
How can we ignore that? How can we forget about that?
You know, depression and these kind of setting is very common,
Mm-hmm.
right? And there's a high correlation between depression and pain.
Mm-hmm.
So, you know, if a patient is, or if a person is depressed, that individual is more susceptible to experiencing pain. And
Okay.
you know, there are a lot of different techniques and modalities that physical therapists use
Mm-hmm.
to address pain,
Mm-hmm.
right? And you know, that's also one way we can help these patients.
And then with that, and then in terms of what do you call this? With pain, some of them may not necessarily be addressed by Medicare Part A, right?
Exactly.
And that's where, again, Medicare Part B will go ahead and live. And we mentioned about the quality of life as being an important factor to our lives. Why quote unquote, suck it up with that pain if you're going to have a physical therapist that's compassionate and dedicated to go to your well-being, to go in and help you to relieve the pain, and again, just enjoy life a little bit more.
That is true.
So, so again, there's so many more advantages than a $20 per visit. And we're not saying $20 per visit and belittle it. We know how $20 is a very important $20. We completely understand that. But if that $20 per visit is going to help you have a better quality of life, prevent a whole bunch of other problems that could be produced because you fall, or your quality of life is so bad because you're so much in pain, and then now you're drinking all of these painkillers, which is obviously not good for you either. It's just something that hopefully will be worthwhile for you to go ahead and consider, of a $20 per visit, working with a medical health professional. And hopefully you guys could go ahead and find ways to go ahead and find value of that with all the things that we listed to your quality of life, and again, preventing the decline, not only cognitively but also physically. All right. Well, I know you keep bringing something up. Anything else that we're missing here? That's good stuff.
Well, education, you know,
Mhm.
videos like this, presentations
Mhm.
directed to the patient, not just the patient, but also to the family and the staffs.
Yes.
That can also be very helpful. Educating them in terms of, you know, all of these ALFs, they usually have like certain activities that they do every day or every
Yes.
week. We can also intervene with that, try to modify it so that physical exercises are incorporated to these activities.
No doubt. And that's where, yeah, at these ALFs, you have these activities coordinator, just again, working for both Medicare Part A and Part B, just to go ahead and find out what can be done, what can be modified. Just I like that idea. For example, in terms of if you were a tennis player before, maybe holding a racket and being a tennis court may not be that life anymore, but this is still same range of action and motion, and going back and forth. Why not? Enjoy life a little bit more.
Yep.
Guided by again, a licensed medical professional. Why not? All right. So again, so please consider all of these options out there. And as he mentioned, in terms of education, that's why we have these beanbag banter videos and podcasts. And for those who have tuned in live, we appreciate you guys. Thank you for joining in. We appreciate that. Feel free to go ahead and share this to any of your loved ones that may need this information to go ahead and make intelligent decisions about what they need to do, and just, again, have a better quality of life. So thank you, everyone. So we'll go ahead and end these live podcasts.